Hi everybody and welcome to the University of Ottawa Heart Institute. Bonjour à tous et bienvenue à l'Institut de cardiologie de l'Université d'Ottawa. My name is Emily Serrano and I'm an advanced practice nurse for smoking cessation. And it is my pleasure to MC today's announcement with the Honorable Minister Sachs, the Minister of Mental Health and Addictions and Associate Minister of Health. Before we begin, I would like to start with a land acknowledgement. The University of Ottawa Institute is on unceded traditional territory of the Algonquin Anishinaabe and the people of the Algonquin Anishinaabe Nation, which encompasses the watershed of the Big River, now commonly known as the Ottawa River. The Algonquin Anishinaabe have been here in the watershed for thousands of years, long before European contact, and will continue to be here well into the future. We recognize all Indigenous people in the region from all nations across Canada who have also made Ottawa their home. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. We dedicate ourselves to moving forward in the spirit of partnership and reconciliation. Together, we take responsibility for the heart health of all people in the region. We are truly grateful to host this important announcement here at the University of Ottawa Heart Institute. As Canada's largest and most foremost heart health centre dedicated to understanding, treating, and preventing heart disease, we know how mental health and addictions are deeply intertwined with cardiovascular well-being. I would like to now introduce our first presenter today, Katie Rayner, Chief Scientific Officer and Vice President of Research at the University of Ottawa Heart Institute.
Thank you so much, and thank you everybody for being here, and thank you particularly to Minister Sachs. We are not just delighted to host this announcement today, but we're really, really proud of the work that we're doing here at the Heart Institute, and we're going to hear about some more of it related specifically to smoking cessation. But it's one of the many programs that we really know make your heart healthier. It's not just about getting the best cardiac care. It's not just about, the fixes that we do so very well, of course, but there's an entire aspect of heart health that involves all sorts of different kinds of wellness. Again, smoking cessation will be talked about today. But something else I know that Minister Sachs, we spoke about already is the mental health aspect of your heart health. And it's so important. And it is something that we take very seriously here at the Heart Institute, and we have programs, to be able to do that for our patients, to be able to, again, keep that wellness, that heart wellness in the full spectrum. And we also do, this is where research is really where we make these important observations, these important discoveries. We don't know how best to take care of your hearts or to help keep them well until we ask the research questions, until we do the studies. And that's been in our DNA for a very long time. Research actually is where your cardiac care begins. So today we're delighted to be able to help promote this announcement into the important work being done in tobacco and smoking cessation, to promote our own work and our own successes, of course. But thank you to Minister Sachs for emphasizing not only tobacco and smoking as key to health and wellness of the heart, but also mental health as well. So thank you, Minister Sachs. We're delighted to have you here.
Hello, everyone, and thank you, Emily and Katie, for the warm introduction, and also thank you for the land acknowledgement. Those of you who may know me, I take land acknowledgements actually quite to heart. Excuse the pun for being here, because it's about our journey of healing as a country. And, I can think of no better place than being right here to talk about healing. And it's a journey that we are taking with our First Nations, Indigenous and Métis, Indigenous, Inuit and Métis people, because we all share this sacred land, and healing together means that we will build a Canada that is whole. It's such a pleasure to join you here today. I want to thank the University of Ottawa Heart Institute for welcoming us, really, for everything you do for the people of Ottawa and the surrounding area. A medical space is always busy, it's always bustling, and so the fact that you've made time for us here to make this important announcement today is really special. And unfortunately, one of the things that keeps you so busy is the impacts of tobacco. And people use substances, including tobacco, for many different reasons. But a lot of it has to do with their mental health. And tobacco is one of those substances that people use to alleviate stress, anxiety, depression. And we know that when we address both their health issues, we need to address the mental health issues of why they choose to use substances as part of managing their day-to-day lives. But we know that there are significant impacts. Every year, 46,000 people die from tobacco-related illnesses. This makes tobacco use the leading preventable, and I say preventable, cause of premature death in Canada. And in fact, it kills half of all long-term daily tobacco users. And that's 46,000 loved ones and people who we care about deeply. Tobacco use is estimated to cost Canadians over $11 billion a year, individually and collectively, in areas such as medication, healthcare, and lost productivity. And there's no way to quantify the suffering experienced by people who become ill with tobacco-related illnesses. You know, we always lean into numbers and science and evidence, but behind every one of those numbers is a loved one, is a person who struggled with their health, and they struggled with their mental health as well. And our government continues to recognize this, and that's why we invest in enforcement and public education to reduce smoking rates and to protect Canadians from the harms of tobacco use. Because we are partners in the health of Canadians each and every day, just as all of you are here. And these investments are meant to protect Canadians. They're not free. They cost a lot. And until now, the cost has been borne by taxpayers instead of the tobacco companies who make these products. And the fact is that tobacco manufacturers who generate revenues in excess of $4 billion absolutely should contribute to the cost of implementing the legislative and regulatory frameworks that we have put into place. So that's why we're here today. It's my great pleasure to announce the launch of the new Tobacco Cost Recovery Framework. This framework is ensuring that these companies, rather than taxpayers, pay to fund our public health efforts to curb tobacco use. It will also make clear that companies are accountable for their actions and for the health of Canadians. The tobacco charges regulations, which will implement the new framework, will require tobacco manufacturers to pay their first charges in 2026. I'm pleased to announce that we are investing nearly $12 million through our Substance Use and Addictions Program, fondly known as SUAP to many, 8 new projects that will help reduce tobacco use across the country. From Vancouver to Toronto to Ottawa to Fredericton, from coast to coast to coast, these projects will help reduce the harms caused by tobacco. They'll include a wide range of education, social support, research, and smoking cessation programs. So really a full continuum of support to meet people where they're at with their tobacco use, to help ease their transition to understanding why quitting is better for them and why we are here to help. Since 2018, we've committed $66 million annually to help Canadians quit smoking and reduce the harms of nicotine addiction. The measures announced today are just another step in meeting the goals set out in Canada's tobacco strategy. So how do we do this? We work with partners, we work with stakeholders, all orders of governments, health institutions like these, to protect Canadians from the harms caused by tobacco use. And with today's announcement, we're delivering on one of our key commitments to shift the cost of tobacco use to tobacco companies. And by shifting these costs, by regulating this industry back to the manufacturers who profit from it, we can reduce the burden on taxpayers and truly get health interventions to Canadians. Because I know that together we can protect and improve the health of all Canadians. Thank you, merci. This is a big deal. I'm actually really pleased to now introduce Dr. Hassan Mir, a member of the team here at the hospital, to talk a little bit more about the impacts of this announcement today and the work that you do here. Thank you.
Thank you so much for that announcement, Minister Sachs, as well as distinguished guests. It's my honor to be up here to speak to you at this historic announcement, as you've heard, at the University of Ottawa Heart Institute. And as Minister Sachs has stated very clearly, smoking is the leading cause of death and disability that is preventable. Those who smoke are at an increased risk of having various types of diseases, whether those include heart disease, lung disease, cancers, etc., and pretty much any aspect of your body, all related to the use of this substance, tobacco, and specifically commercial tobacco. And what we know is that compared to those who don't smoke, people who smoke tend to live 10 years shorter, and we've heard about some of the numbers, but 10 years life expectancy. But even in terms of the quality of life for those individuals who happen to live shorter lives is significantly affected by their use of tobacco. And as Minister Sachs has stated, it's not just for the people that are smoking. It's literally from second and third hand smoke for those that are around them, saying nothing about the impact, mental, physical, social, economical, for the family members that are struggling with the effects and the harmful effects of tobacco. What we know is for people that smoke, quitting is the best thing you can do for your health. There's nothing better. And frankly, short of vaccinations, there's nothing really better, and we talk about childhood vaccination, there's nothing as a preventative intervention that's better than smoking cessation. Whether that's to reduce the risk of developing disease or improving your life expectancy. But what we need to appreciate is that we need to support our patients, our community, our population and citizens to support them in this goal to quit smoking. And the reality is there are excellent individual interventions that exist to support people who smoke to quit, which includes counseling and follow-up, medications, and these have been demonstrated through decades of research to be effective in helping people quit smoking or to reduce their usage of cigarettes. Even system-based approaches, such as the Ottawa Model for Smoking Cessation, which I'm honored to serve as chair of, have been demonstrated to significantly not just improve the rates of smoking cessation, but improve clinical outcomes like mortality, hospitalization, and cost effectiveness to such a degree that we benefit from governmental funding to support it through evergreen funding. So, we're very, very fortunate to support, and we support about 20 to 30,000 people that smoke on their journey to reduce or quit every year, and supported over 500,000 since inception about 15 years ago. But the outstanding work that's being done by clinicians, researchers, and NGOs has to be matched and is being matched and supported by endeavors by our policymakers and government individuals at the local, regional, including provincial, and the national level, as we're seeing. And the announcement today does just that. It's an investment into the healthcare and the overall health of Canadians. The funding will enable programs such as like ours, which are implemented in healthcare settings across Canada, from border to border, north, east, and west, to help countless Canadians on their journey to reduce or quit smoking. As we look to the future, sustainable funding through programs like this will be necessary to continue to fund our clinical and research programs aimed at smoking, but also other forms of addiction that we've talked about, like vaping and alternative nicotine products, which can potentially be a gateway to tobacco use. And it'll be vital, this type of funding and support will be vital for the strategy and as planned to achieve the 5% prevalence by 2035, as had been set as a target by the federal government. So we wish to thank you, Minister Sachs, and the federal government for your continued effort, and look forward to partnering with you to end the harms of commercial tobacco use. Thank you so much. And I'll pass off to Emily.
So thank you so much to all our speakers. Merci à tous nos présentateurs. This announcement by our presenters today reminded us the importance of continuing to support Canadians and to hold the tobacco industry accountable. We will now move on to our next portion of the announcement, where I would like to introduce our moderator for the Q&A period, Yuval Daniel, Director of Communications, who will moderate our media portion of the announcement.
From the media, please state your name and outlet, and one question, one follow-up. Okay, we will now turn it over to questions from Zoom.
Thanks, Yuval. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous êtes journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. We'll now proceed to questions from journalists online with Zoom. And if you're a reporter and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. Please modify your Zoom handle to reflect your name and media outlet. We have one hand up. Mandeep, did you want to announce yourself and your media? Okay, no hands up. I'll turn it back over to you, Yuval.
The press conference. Thank you so much.
Okay, well, thank you, everyone. I guess there's no questions because everyone's so happy with the announcement. And just a special thank you to the team here for the tour we had earlier. As I shared with you, and happy to share with the audience here, I'm a former heart patient, pediatric patient, and really it's heartwarming to see the work. And there goes all the activities of the hospital. So thank you for all that you do. So grateful. Have a great day, everyone.